Hey everyone, welcome back. Today we're going deep on something super practical, fall prevention in older adults.
Really important topic.
Yeah, and we really want to give you guys some actionable points that you can actually take into the clinic, with your patients right away.
Absolutely.
We've got 3 great research articles that we're going to be looking at today. The first one is from all the way back in 2021.
Okay.
It's the Evaluation of Clinical Practice Guidelines on Fall Prevention and Management for Older Adults, a systematic review. And that was published in JAMA Network Open.
It's a systematic review. Nice.
Yeah, and then we've got 2 more recent ones from 2024. One's from Age and Aging. It's called Factors Influencing Older Adult Community Fall Prevention Exercise Implementation, a scoping review.
Okay.
And then the last one is from BMC Geriatrics, Qualitative Comparative Analysis of Exercise Interventions for Fall Prevention in Residential Aged Care Facilities.
Great. So we're going from the big picture down to the nitty gritty.
Yeah, exactly. We're going from guidelines to, how do we actually make this work? Yeah. So let's jump right in. I think one of the things that really struck me about that JAMA review, looking at all those clinical practice guidelines, 15 of them.
15.
Right? That's a lot.
That's a lot to synthesize.
Yeah. And the thing that was really surprising was how much agreement there was across the board.
Yeah, I think it's reassuring to see that consistency,
Yeah.
And I think, what that tells me is that there is good evidence behind these recommendations, so that's great.
Yeah, for sure. And one of the big ones that stood out right away was risk stratification. Every single guideline.
Yeah.
This is essential. You need to be identifying those patients who are at highest risk.
Right, because we all know falls are common in older adults.
For sure.
But it's that subset that's at really high risk that we need to be able to tease out and then target our interventions appropriately.
Yeah. And it sounds like assessment tools are really key for that.
Oh, absolutely.
Like being able to actually assess gait imbalance.
Right, and it doesn't have to be anything super complicated.
Yeah.
The timed up and go test that we all learned in school is actually a really good one. That's a really good predictor of falls.
Quick and easy.
Right in the office.
Yeah, and of course you can't forget about a medication review.
Oh my gosh, so important.
Right.
Polypharmacy is just rampant in this population, and we know so many medications can contribute to falls.
Especially things affecting blood pressure or cognition.
Absolutely anything that can cause dizziness or sedation.
Yeah, it's really looking at the whole picture, isn't it? It's not just those physical factors.
Right, it's multifactorial.
Right.
We've got to consider the cognitive impairment, the fear of falling, Are they afraid to get up and move around because they're worried they're going to fall?
Yeah.
Environmental hazards in the home, that's a big one.
For sure. So many things going on.
Yeah.
And speaking of things going on, that JAMA review also pointed out something really crucial that was missing from all of these guidelines.
Yeah, and that's something we really have to pay attention to, and that's the patient and caregiver perspective.
Yeah, these guidelines are great.
They're a great starting point.
Yeah, but how are we actually supposed to implement this?
Right, and what are the barriers? What are the things that are actually happening in the real world that might not be captured in these idealized guideline settings?
Makes you wonder how many great strategies are out there that we're just missing. Because we're not asking the right questions.
Exactly. Right.
So what can we do better here?
I think it really starts with listening, really asking those open-ended questions like, what are your biggest concerns about falling? What feels doable for you right now?
Yeah, making them feel like an active participant in their care.
Absolutely.
Right.
It shouldn't be a one-way street.
Yeah, so let's shift gears a little bit and dive into the nitty-gritty of actually implementing some of these things.
Okay.
That scoping review from Age and Aging, it was looking specifically at those community-based exercise programs.
Yeah.
And oh my goodness, they found a lot of factors at play.
It sounds simple.
No, over 290 facilitators and barriers.
Wow.
That's a lot.
It's a lot.
So what are some of the key takeaways there for people listening? What do they really need to know?
So I think it's helpful to break it down into kind of 3 levels.
Okay.
So first, you've got the individual factors. Is the patient motivated?
Yeah.
Do they actually want to participate in this program?
Makes sense.
Do they have transportation to get there?
Oh, yeah, that's a big one.
Right. So many practical things that we don't always think about.
Right.
Then you've got the program characteristics themselves. Is it offered in a convenient location?
Yeah.
Are the times appropriate? Does it cater to different ability levels? So many things to consider about the program itself.
Yeah.
And then finally, and this is maybe the most important piece, is communication.
Communication, so just making sure the patients understand the exercises?
It's bigger than that.
Okay.
It's about clear communication between healthcare providers, between the organizations that are involved, The staff members, even communication amongst the participants themselves.
Oh, right.
Everyone needs to be on the same page.
Right, so if one of those links breaks down,
Exactly.
the whole thing could fall apart.
The whole system can kind of crumble. So
Yeah.
it really emphasizes the need for this holistic systems level approach to implementing these programs.
And so now I want you to think about your own practice for a moment. What are some of those barriers that you face when it comes to, actually putting fall prevention into place? And then what are some of those facilitators that you might be able to leverage?
Yeah, that's a great point.
So let's shift gears one more time and zoom in on the exercise programs themselves.
Okay.
That QCA study from BMC Geriatrics that was looking specifically at residential care settings.
Right.
They had some really fascinating findings.
Yeah, I think this one really drilled down into what are the characteristics of these exercise programs that really matter?
So what is that secret sauce? What do we need?
Right. So they actually identified 3 key conditions for success.
Okay, lay it on me.
Okay, so first, the participants need to be mostly independent ambulators. So they need to be able to walk with or without an aid,
Okay,
but generally getting around pretty well on their own.
got it.
Second, the exercise intensity needs to be moderate to low.
Okay.
You don't need to be doing boot camp here.
No crazy CrossFit for these guys.
Exactly.
Okay.
And then third, and this was really interesting, group exercise was crucial.
Wait, hold on. Group exercise.
I know.
Like, I'm picturing a bunch of older adults trying to do Zumba.
No, not Zumba.
Okay.
Nothing like that. Think more along the lines of structured activities that improve balance and strength
Okay.
and are tailored to different ability levels, but done in a social setting.
Okay, so it's not just about, the physical benefits, it's about the social emotional aspects as well.
Absolutely. It fosters that sense of community. It provides motivation and support. It can even boost cognitive function.
That's amazing.
It's huge, but remember, tailoring is still crucial.
Yeah.
Even within a group setting, we need to adapt the exercises to those individual needs and limitations.
Yeah. So I'm sensing a theme here. Individualization is
Yeah.
a big takeaway from all of these studies.
Absolutely. And I think, that's something we're going to talk a lot more about in the next part of our deep dive is how do we actually take that individualization and put it into practice?
Awesome. Well, let's take a quick break and we'll come back and figure out exactly how to do that.
Welcome back. Now let's talk about how we actually take this concept of individualization and really put it into practice.
Yeah. Because it's one thing to talk about it in theory,
Yeah.
but how do we make this work in our busy clinics?
Right, exactly. So let's go back to that JAMA review that we talked about in the first segment.
Okay.
Remember how they highlighted risk stratification as being absolutely crucial?
Yes.
So let's think about how we can translate that into practical steps.
Okay.
So one thing you could consider is integrating a simple fall risk questionnaire
Okay.
into your intake paperwork.
Ooh. I like that. They make it part of the routine workflow.
Exactly, so it doesn't slip through the cracks. And then for those patients who do flag as high risk, you've got your more detailed assessments ready to go.
Gotcha. So you're kind of triaging them a little bit.
Exactly. So you can really focus your time and energy on those who need it most.
And that's key because we all know time is always a constraint in clinical practice,
Oh, tell me about it.
right? So any tips for how we can maybe streamline some of these assessments?
Delegation is your friend.
Oh, yes.
Nurses and medical assistants can be trained to conduct those initial screenings.
Yeah.
Or even administer some of the basic tests like the timed up and go.
That frees you up to do those more in-depth conversations.
Exactly. And speaking of conversations,
Yes.
remember how we talked about how important it is to involve the patient and their caregivers
Absolutely.
in the decision-making process?
Yeah, it's not just about dictating a plan. It's about...
It's a collaboration.
Yeah.
So instead of just handing them a list of recommendations, start by asking some open-ended questions.
And what?
Like, what are your biggest concerns about falling? Or what feels doable for you right now?
Yeah, I like that you're really making them feel heard and empowered.
Exactly. And it helps you tailor your recommendations to their specific needs and preferences.
Right, so going back to those multifactorial interventions that we were talking about.
Yes.
It's like you're building a personalized toolkit for each patient.
Exactly.
So what kind of tools were we putting in this toolkit?
Well, exercise is always going to be a cornerstone,
Good.
but it doesn't have to mean a gym membership.
Right.
You know that QCA study showed the power of moderate intensity group exercise,
Yeah.
especially for those who can walk independently.
So those community exercise classes that are out there.
They can be fantastic.
Yeah.
But of course, we still need to consider individual abilities and limitations.
Right.
So maybe for one person, it's a Tai Chi class. For another, it's a walking group.
Yeah.
For another, it's just encouraging them to take a daily stroll with a friend.
Yeah. I love that. And it gets them, those social connections, which is so important as we age.
Absolutely.
So exercises in the toolkit. What else?
Medication review is another essential tool.
Okay.
Carefully evaluate all medications, considering potential interactions and side effects that could increase fall risk.
Yeah, that's a tough one because, we're trying to manage all these different health conditions.
Right.
But then also make sure we're not increasing their fall risk.
Exactly. It's a delicate balance.
Yeah.
And let's not forget about those simple environmental modifications.
Oh, right.
A home safety assessment can uncover hazards like loose rugs or poor lighting.
Yeah, sometimes it's those simple things that make a big difference.
Absolutely. And assistive devices like canes or walkers can also be helpful.
Yes.
But we need to make sure they're properly fitted.
For sure.
And that the patient knows how to use them safely.
Yeah.
And of course, regular eye exams and addressing any visual impairments.
Right, so it's like we're layering these different interventions to create a safety net for our patients.
Exactly. And remember, this is a team effort.
Yes.
Don't hesitate to involve other healthcare professionals like physical therapists,
Occupational therapists.
pharmacists. They can all bring valuable expertise to the table.
It takes a village.
It does.
So we've assessed their risk.
Right.
We've had those, open and honest conversations. We've put together this really nice personalized plan. What comes next?
Ongoing monitoring and follow-up are essential.
So we can't just set it and forget it?
We can't.
Okay.
We need to regularly reassess their risk factors, review their progress, make adjustments to the plan as needed.
So it's a dynamic process, just like our patients are constantly
Absolutely.
evolving.
It's not a one and done kind of thing.
Gotcha. And what about patient education? Where does that fit into all of this?
Patient education is paramount throughout this entire journey.
Yeah.
We really need to empower them with the knowledge and skills they need to be active participants in their own fall prevention.
Yeah, because ultimately they're the ones who are, living their lives.
Exactly.
Making those decisions.
Right.
So how do we take all of this information and distill it into something actionable?
So let's talk about some practical takeaways that you can start using today in your practice.
Perfect. Let's do it. Okay,
Yeah.
so let's crystallize all of this amazing information that we've talked about into some concrete strategies that our fellow healthcare providers can take and use right away. What are your top tips for making fall prevention just a seamless part of clinical practice?
I think a lot of it comes back to those systems that we talked about.
Yeah.
That simple fall risk questionnaire during intake.
Yeah.
Brilliant. Make it automatic.
Yeah.
And remember, delegation is your friends, nurses, and medical assistants. They can be trained to do those initial screenings.
Right.
Even some of those basic tests.
Yeah, that frees you up for those more in-depth conversations with the higher risk patients.
Exactly.
Now, what about those conversations? Any tips for making sure that they're really productive and actually lead to those actionable plans?
I think one thing that can be really helpful is instead of overwhelming patients with a laundry list of recommendations, present a few key strategies and say something like, which of these resonates with you? Or what feels achievable right now?
I love that.
It really shifts the dynamic from doctor's orders to we're problem solving this together.
Yeah, it honors their autonomy. And like you said, that motivation piece is so important.
Absolutely.
They're more likely to actually do it if they feel like they're part of the process.
Exactly. And remember those multifactorial interventions, they're like puzzle pieces.
Right.
You're not trying to force fit all of them in. You're picking and choosing the ones that make sense for that individual patient.
So it's about customization, not a cookie cutter approach.
One size does not fit all.
Speaking of customization, any tips for getting creative with those exercise recommendations?
Oh, yeah. Think beyond the traditional gym setting.
Okay.
Maybe it's a community dance class.
Oh.
Maybe it's a Tai Chi group at the senior center.
Yeah.
Maybe it's a walking buddy system.
Yeah.
Tap into their interests, tap into those social connections.
Oh, love that.
And remember that QCA study showed the power of group exercise, even moderate intensity,
Yeah.
for those who are relatively mobile.
So important.
Huge social and emotional benefits, not to mention the cognitive boost.
Yeah.
But even with group exercise, we still need to tailor it to
Right.
those individual abilities. So maybe someone needs a chair for support during certain activities or, modifications to the exercises.
It all goes back to individualization.
It does.
What about those kind of often overlooked areas that JAMA review highlighted, like hip protectors and digital technology?
Yeah, I think it's important to stay informed about these kind of emerging areas.
Right.
Hip protectors might be a good option for certain high-risk individuals in nursing homes.
Okay.
Wearable devices can offer real-time monitoring and fall detection.
Right. Technology is really changing the game in a lot of ways.
It is.
Any final pearls of wisdom for our listeners before we wrap up this deep dive?
I think the biggest thing is embrace that mindset of continuous learning and adaptation.
Yeah.
New research is always emerging. Patient needs are always evolving. So stay curious, stay flexible, and keep those conversations flowing.
Beautifully said. So, to sum it all up, assess, individualize, collaborate, and adapt.
I love it.
It's not about finding that magic bullet solution. It's about understanding the unique tapestry of each patient's life and weaving in those strategies that empower them to live safely and independently.
Couldn't have said it better myself.
We hope you found this deep dive insightful and practical fishing. Remember, fall prevention is an ongoing journey, and we're all in this together.
We are.
Be sure to check the episode description for links to those studies that we discussed and any additional resources. And until next time, keep learning, keep growing, and keep making a difference.